Welcome to the third module of our Family Caregiving 101 series. My name is Mark Peterson, founder of the Wyoming Family Caregiving Foundation. Last session, we focused on assembling, organizing the family caregiving enterprise, and obtaining the resources for a loved one living with an illness. In this session, we will focus on the performing activities family caregivers do when caring for their loved one living with a chronic illness such as cancer, heart or lung disease, or neurodegenerative diseases such as Alzheimer's, dementia, Parkinson's disease, or ALS. Researchers define performing as directly integrating resources to co-create value with the loved one. Many of the performing tasks are similar to those nurses or nurses' assistants would do in a hospital or clinic. Last session, we learned that some corners of the medical establishment, such as the University of California, San Francisco Brain Tumor Centers, present family caregiving as similar to a complex business project. Accordingly, agentic family caregivers, those taking initiative and pursuing self-direction, will serve their loved ones as resource integrators similar to entrepreneurs developing a venture. As a loved one's health dips, the effort required by the family caregivers to maintain their loved one's quality of life goes up. Many of the performing tasks done by family caregivers would occur during such declines in a loved one's health condition. Your loved one may lose or has already encountered difficulty in accomplishing one or more of the 6 activities of daily living, or ADLs. These include dressing, eating, bathing, toileting, continence, and transferring. Many caregiving family journeys begin with an event that causes the loved one to be admitted to a hospital. In our hospitals, thankfully, we have well-trained professionals to do the work of modern medicine. This almost invariably means that the staff does everything in caring for your loved one, and you watch. In other words, you do nothing. However, in your home, the staff are no longer there, and it is up to someone else to provide care. You. Patients often learn to love their nurses and nurses' aides tending to them around the clock. But at discharge from the hospital, a nurse will have to break away from their other duties to provide care instructions in the home. These typically focus on explaining the instructions and cautions for taking multiple medications by the patient in the coming days and weeks. Each medication might have 5 pages of printed instructions, warnings, and disclaimers. There might be an additional stop to make at the hospital pharmacy to pick up these medications. In short, the home care briefing for you and your loved one might take 10 to 15 minutes, but it will likely be taken up by explaining the medications and the regimen for them. Certified nurses assistant training typically encompasses dimensions such as the foundations of nursing care, such as vital signs, hygiene, mobility assistance, toileting, feeding, and dressing. CNA candidates learn how to improve communication with patients who have cognitive or sensory impairments as well. My youngest daughter, Rachel, earned her CNA certification and remembers that a major theme of the instruction was to remain calm in all situations. Don't freak out, hang in there, and figure things out for the benefit of your patient. The lesson here for family caregivers when performing hands-on tasks with their loved ones is to remain calm and figure things out. To help you gain a perspective on the performing tasks you might encounter as a family caregiver, we will take a brief tour of medical supplies that you might employ in family caregiving. About 17 months into my late wife Cindy's battle with brain cancer, she became hospitalized due to blood clots that had developed in her lower legs and had migrated to her lungs. Knowing that caregiving for her in her home would intensify when she was discharged from the hospital, my 25-year-old daughter Rachel and I made a trip to a used medical equipment store in northern Colorado near the medical center of the Rockies called Good Health Will. Walking through the warehouse at Good Health Will was like being on another planet in that we saw medical devices and equipment, but we frequently had no idea what these devices and equipment would actually do for someone in a caregiving situation. Then as the weeks went on and we were fully engaged in performing tasks of caregiving, Rachel and I would remember some of those strange-looking devices and exclaim, "Oh, now I realize that device at Good Health Will would help us do this task in caregiving with which we are struggling." The next slides will feature the medical equipment and supplies on the Good Health Will website. Bath and shower chair. A loved one can now sit during a shower or bath. We use this device regularly. Bed pads were used multiple times each day to keep leaking or soiling of bed linens once incontinence develops. Adult diapers don't always contain bodily fluids, so those chuck pads are needed under the patient. Use liberally through the day, on furniture, on the bed. Roll them up after use and chuck them in the trash. That's why they're called chuck pads. Catheter bag and tube. These are often referred to as a Foley catheter. Once the tube is in place in your loved one's bladder, urine flows into the bag. This means your workload of taking your loved one to the toilet has gone away. The tube ends can become clogged, though, with sediment and urine, which means the bladder fills and fills. Talk to a nurse about how to work with these Foley catheters before your patient goes home from the hospital with one of these inserted. The portable commode. Once in use, I declared this was the best $50 I spent that year. Using it means that caregiver does not have to do the 10-minute procedure to retrieve a wheelchair for the loved one, get it set up, make a transfer into the chair, wheel it to the bathroom, and make another transfer there. You just set the portable toilet near your loved one and you make the transfers there. Those fighting chronic illnesses often struggle to be as active or as mobile as they used to be. This means that they can become more sedentary. A hazard of this is that blood flow in the lower legs can slow and even pool. Keeping compression socks on your loved one will help the blood stay higher in the legs rather than gathering in the lower legs. Keeping your loved one's legs elevated will need to be done as well. Disposable gloves. Buy them in bulk. Use them in all of your performing tasks for your loved one. The gait belt, also called a transfer belt. This is for patients with mobility challenges. You would wrap the gait belt around the patient's waist over their clothing, not directly on the skin. The belt should lay flat with no twists. You would fasten the buckle and tighten the belt so it's snug but not restrictive. You should be able to slide 2 fingers underneath it. Hold the gait belt from the back or sides using an underhand grip with your palms up for better control and ergonomics. Never lift the patient by the belt, but use it to guide and support during movement. Later, I will show you how I use the gait belt in making transfers with my patient, Cindy. We had grab bars installed in the shower once we returned home from the hospital. 1 vertical, 1 horizontal, and 1 diagonal on the walls of the shower. We should have installed 1 outside the shower because Cindy grabbed a towel rack once exiting the shower and pulled it out of the wall. A handheld shower head will keep your loved one shower and bathing. As Cindy's mobility declined, I would dress in swim shorts and get in the shower first. As time went on, 2 other persons would be needed to help me lift Cindy into the shower onto a shower bench. With soap and water, everything is slick and dangerous in the shower. The movable shower head can help you clean your loved one more effectively and more quickly. You might think that your loved one will never become bedbound, but even if they are only temporarily bedbound, a hospital bed that can crank to different positions would help your loved one during the day. Such maneuverability can also help in transfers. If your loved one uses a fashionable high bed from before their diagnosis, this likely won't work for them or for you as a caregiver. At a minimum, obtain a bed closer to the ground. If you live in a drier climate region, winters will likely have air in the home with a lower humidity level. This can lead to more brittle skin for your loved one. When combined with certain medications, your loved one's skin can become paper thin. In such a situation, wounds or open sores can appear that can be resistant to healing treatments. Help your loved one and keep the humidity level to 50% or more. Keep the humidifier running, which will mean a couple of water fill-ups during each 24-hour period. Keeping your loved one hydrated might at times require an IV bag flowing for them. Some medications might also be administered using an IV tube and bag. Your hospital will let you know when the IVs are needed. The lift recliner or power lift chair helps your loved one make less effortful transfers because you can activate the motor in the chair to lift your loved one up and forward. The favorite chair your loved one might use in your home prior to their mobility decline might not be as comfortable as a power lift chair designed with patient comfort in mind. That favorite chair might be too narrow for you to perform an adult diaper change to. Cindy really liked her power lift chair and it reduced the workload for patient and caregivers. We didn't use an alarm, but we did use a baby monitor. This allowed me to be in another part of the house, such as the basement, where I would use an elliptical trainer to stay in shape and keep an eye on Cindy while she napped during the day or slept at night. A cell phone for your loved one can serve as an alarm, but if cognitive ability declines, having a button-activated system around the loved one's neck makes sense. I bought a Hoyer lift from Good Health Will. It stayed in our bathroom because it takes up a lot of space. I demonstrated it on Cindy once so she could become comfortable with it. I didn't use it after that, but importantly, it represented my ability to transfer Cindy in the case I encountered a back injury or some other reason for not being able to transfer Cindy. In effect, it became insurance for me as a caregiver. It was worth the money to have the peace of mind that transfers could continue for Cindy despite my own unexpected health challenges. During hospice in our home, these wedges became invaluable. When a patient is bedbound, they must be turned every 2 hours to avoid developing painful bed sores that might get infected. Turning is not a suggestion, it is an absolute requirement. And as a family caregiver, you need a system to take the pressure off different parts of your loved one's body. Cindy wanted to have an external ramp installed outside the front of our home. The estimate from an accomplished craftsman specializing in such ramps was $20,000. I thought about it long and hard. I finally went online to Amazon and searched for ramp. I found something similar to these for $50. You put them in place when you need them and put them up and out of the way when not needed. I used them to take Cindy outside for walks in her outdoor wheelchair, put them on the front steps, and used them to wheel her down and wheel her back up when we were finished. A slide board is a smooth and shellac flat board. We used our slide board for moving Cindy into the shower from her wheelchair to the shower bench. It can also be used in making transfers to and from the bed and wheelchair. We used syringes to administer medications to Cindy as her cognitive ability declined late in her cancer battle. We learned we had to grind up pills using a mortar and pestle and then put the resulting powder in some pudding for Cindy. Otherwise, she would take the pills out of her mouth and set them aside instead of swallowing them. With a liquid diet, we blended food and used the size 0 syringe, the biggest, and allowed Cindy to suck out the pureed food at her own pace. An aluminum walker can help those with stability issues when walking to retain mobility. If a loved one loses mobility on one side, then the loved one will just move in a circle. The walkers help those who can use both sides of their body move with more stability. Cindy was doing furniture walking to move around the house when her stability became reduced. She wanted to retain her independence intensely. I went to the medical supply store and bought a nifty wheelchair I thought she would like. Once she started using it, she did like it. However, the wheels were made of hard rubber. Outside on the sidewalk or asphalt, we needed to obtain another wheelchair with inflatable tires. Turned out the outside wheelchair was too wide to go into the bedrooms of our 100-year-old home. We wound up using an indoor wheelchair and an outdoor wheelchair depending on where Cindy would go. Wipes. Buy in bulk and use abundantly. Cindy developed wounds on her lower legs, probably due to the steroid medication she was required to take, which caused a thinning of her skin. We had our own kit with a variety of gauzes, pads, tapes, and scissors. We had to change these dressings at least once per day, and it took around 30 minutes of careful work to do this. During the 3 weeks of Cindy's post-brain surgery rehabilitation at Poudre Valley Hospital in Fort Collins, Colorado, the nurses posted on the whiteboard each day in her room. Under goals, Cindy had the nurses put 2 things. 1, attending the wedding of our youngest daughter, Rachel, the next month in Jackson, Wyoming. And 2, going with her family to Disney World the next year. Both trips happened. However, on the car trip to Jackson, about 6 hours normally from Laramie, Wyoming, we learned that for car travel, Cindy needed a rest stop from the road vibration in the car every 90 minutes, or she'd get a headache or become nauseous. Later at the wedding, we worked in quiet rest away from the activity just so Cindy could feel up to later engagements with everyone. When we went to Disney World, we asked park attendants about finding such a place, and we found out that the first aid building at Disney World had visitors come in throughout the day for such a reason. I wound up taking a nap with Cindy there, and it was quiet and the staff was very helpful. In sum, there is learning to be done for making a road trip a success for your loved one. About a year into Cindy's cancer battle, a tumor recurred. Cindy enrolled in a clinical trial conducted at Cleveland's University Hospitals then. We made 5 trips to Cleveland by air after that. The last one was about 6 months after the first, and Cindy's mobility had declined. God bless Uber drivers who take rides to the airport at 3 a.m. in the morning in Cleveland. Our flight to Denver that day came in late due to mechanical difficulties that delayed our departure, so we missed our connecting flight home to Laramie from Denver. We would have to stay in Denver another 24 hours with numerous connections and transportation required. But wait, I opened the Uber app and entered my request to be taken from Denver to Laramie, Wyoming. A driver recently immigrating to the U.S. from Myanmar accepted the request. That $120 Uber fee for the 2.5-hour trip to Laramie was certainly worth it. God bless Uber drivers in Denver who take out-of-state trips to Wyoming. In becoming a chef in our house for Cindy during her cancer battle, my nickname became Dr. Smoke. But hey, I became a better cook over time, learning that it is all about inventory management in your refrigerator, cooking up the items that may go bad soon. Here I am with Swedish pancakes made for our family. This is my specialty now. For someone with a serious diagnosis, an afternoon nap is not an option, but a move all physicians will applaud. Your role in clearing out the house and making it quiet is a performing task for your loved one. Of course, this was a 2-hour block of time to be used to execute some task in another part of my life, such as work, because I was employed then. The American Cancer Society has published its Complete Guide to Family Caregiving. It is more like an encyclopedia with short chapters on topics such as physical side effects of cancer treatments and emotional responses to cancer and cancer treatment. Dr. David Servin Schreiber's book, Anti-Cancer, is a valuable offering to those interested in reducing their likelihood of encountering cancer or developing ways for their body to resist cancer or its growth if they have a diagnosis already. Adopting a Mediterranean or East Asian diet and avoiding added sugars in food is recommended by Servin Schreiber, who lived 20 years after a brain cancer diagnosis, a remarkable length of time. When Cindy adopted the anti-cancer diet, I joined her, and surprisingly, I dropped 10 pounds in 2 months. Pursuing this lifted our morale because we were now helping our bodies rid themselves of cancer cells each day. It turns out that each of us has cancer cells in our bodies, but our immune systems attack these cancer cells and flush them from our bodies if our immune systems are working well. This is done each day. If your loved one is moving through the house by reaching and grabbing furniture for stability, they are furniture walking or furniture cruising. When seeing this, it would be a good time to have a meaningful talk with your loved one. In our culture, the loved one will likely insist this is part of retaining their independence and important to them. However, furniture walking is a sign of increased instability and mobility for your loved one. After a bad fall for Cindy, I had to tell her in no uncertain terms that we were now like a dance partners. If she wanted to move, she could cue me or ask me, and I would take the lead, and we would move together. About a month later, Cindy was using a wheelchair in our home. In these series of photos, you can better understand what some call the hug and lift move when making a transfer with a loved one with reduced mobility. First, the wheelchair is positioned perpendicular to the target, here, the bed. Second, the wheelchair is locked in place. You can see my daughter Rachel and grandson baby Ethan watching. Third, the caregiver goes low and leans forward to bring the patient into a hug. Note here that Cindy is wearing a gait belt and the caregiver wears a black shoulder harness for facilitating the patient's ability to grab the caregiver. Fourth, the hug brings the two closer. The caregiver has a straightened back, enabling the caregiver's legs to do the lift. Fifth, with a hold on the patient's gait belt, the caregiver stands up holding the patient. Sixth, the patient is turned 90 degrees on a rotating black disc purchased for this express purpose. Once over the bed, the patient is lowered onto the bed. The caregiver would then finish by lowering the patient's upper body and gathering up the patient's legs to be brought onto the bed. In the last photo, baby Ethan is amazed. We've covered important knowledge for you as a family caregiver in this video focused on performing tasks. You should know that as you develop your family caregiving enterprise, you're becoming a more meaningful person to your loved one. In time, you will appreciate more the opportunity to develop your own character qualities of compassion and service-mindedness toward others. Please join us for the next video in our series about brokering tasks that family caregivers do with those outside of the network of family and friends. This video and other resources to help you become more effective family caregivers can be found at yofamilycaregiving.com. That's www.yofamilycaregiving.com. Thank you.